So let's talk about Medicare Part D and the levels of coverage. This is a visual of a standard Part D design for 2020. Most plans that I work with do not look like this, but they have to meet at least these minimum coverage requirements to be eligible to be approved to be a Part D plan. So the plans with Part D vary, but this is again the minimum coverage that must be provided. For example, some plans may have a lower or a zero deductible or flat copays. Which a copay is a flat amount you would pay on a 30-day supply of medicine or of covered meds in the initial coverage phase. At the bottom is just kind of the Medicare RX, what their symbol looks like on a Medicare Part D ID card. But let's look at this colorful grid here. So if you had a standard Part D design, the annual deductible in 2020 would have a deductible of $435, and that's calendar year. So if you went to the pharmacy, no matter when you started the plan, it always goes calendar year, January through December, you would be responsible for the first $435 of covered meds. Once you satisfy that, and this is all done electronically at the time of purchase, you would enter into the next level of coverage, which is called the initial coverage level. And at this point, on a standard Part D design, you'd pay 25% of covered meds. The plan would pay 75%. This is until the total cost of the drugs that you're purchasing in that year reach $4,020. When I say $4,020, that's between what you pay and what the plan pays. So if you had say a $500 a month med and you had to pay, 25% of that, the insurance company was paying 75%, but the med, that $500 overall cost is what counts toward that $4,020. Now, as I mentioned earlier, many plans do not have this plan design. They make the benefits more attractive, but this is the minimum. Now, if your meds overall cost of the total cost of the covered meds exceeds the $4,020, you enter into that next level. We're moving up the visual here into what's known as the donut hole or the coverage gap. Now, on a standard plan, you would remain paying 25% of eligible drugs, both generic and brand. You will get, people that are on Part D plans receive a monthly report from their plan with information on any med that they filled previously. So they will keep you informed of where you're at in relationship to the coverage gap or the donut hole. So there's no sticker shock when you walk into the pharmacy one day and perhaps you had to pay more. If the gap will end once the out-of-pocket threshold of drugs hits $6,350. And at that point, you'd enter into the very top level, which is called catastrophic. So there would still be a 5% responsibility for eligible drugs. It never goes to zero on a standard Part D design. My recommendation for people evaluating Part D plans is to work with a trusted advisor. There's wonderful tools through Medicare.gov. There's other tools that we can use, or an agent or the senior linkage line, trusted advisors that can help you look at your specific needs so you know what options are available to you based on your county and what your anticipated co-pays or co-insurance would be, making sure that your pharmacies are accepted by that plan, whether you would anticipate hitting the coverage gap. So many things come into this, but there's some wonderful tools available, and we would really encourage you to work with a trusted advisor for that assistance. The extra help that I had mentioned earlier for those on limited income and resources, again, is through the Social Security Administration. It helps cover things like monthly premiums, annual deductibles, and prescription copays. And for help applying, you can contact the Social Security Administration, the state Medicaid office, the senior linkage line. You can also go online, and I did put the website there, ssa.gov/extra help. Now that late enrollment penalty, I always get a lot of questions on that, and I don't want to make it confusing, but so if you choose not to enroll or miss the deadline and later on you're assessed a penalty, what Social Security does is they take 1% of the average monthly prescription drug premium across the country, and then they multiply that figure by the number of months you were late. And then that amount is your penalty, and they inform the insurance company that you do sign up with them that you have to pay an extra amount. And that can add up. I have had a few folks over the many years I've worked in this business that went for many years without Medicare Part D. I think I had one that went 10 years. And so it was 120 months that she went without Medicare Part D or did not have what they call creditable coverage. So the 1%, and I think in her situation, and I can't quote the exact figure, but it was somewhere between 30 and 35 cents. But when you take that figure, it doesn't seem very large, but when you multiply that by 120 months, say for example, at that point I think it was like 33 or something like that. If you take 0.33 and you multiply it by 120 months, she had an extra $40 a month. So if she bought a plan that was $30 a month, she had to pay $70 a month, and that would have been billed right from her insurance company. So the takeaway from this is really work. Again, I would encourage you to work with a trusted advisor to make sure that you're seriously considering Part D, to the penalty doesn't come back and haunt you, because it is a lifetime penalty. I mentioned the word creditable coverage, and what creditable coverage is, it's drug coverage that's expected to pay on average at least as much as Medicare standard. So group insurance oftentimes meets Medicare, exceeds Medicare standard would be creditable. TRICARE, VA, Indian Health Services are examples of creditable coverage, meaning there would not be a penalty if you later signed up.